Yorkshire Cancer Research undertook a huge piece of data analysis in 2016, and the one thing it absolutely showed beyond a shadow of a doubt was that lung cancer was a big problem in Yorkshire.
So lung cancer is the biggest cancer killer in Yorkshire. Over 4,500 people every year are diagnosed with lung cancer in Yorkshire, and unfortunately of those, about 3,500 will die of the disease.
So we're doing lung health checks in community locations around Leeds, and we're identifying patients through GP databases, so people who've smoked in the past or smoke now. And they're invited to ring us for a telephone assessment, and that assessment tells us if that patient is at high risk of lung disease. And if they are at high risk of lung disease, they're invited for a lung health check on the mobile unit.
We launched this programme in 2017 after finding great partners in the University of Leeds and Leeds teaching hospitals, and we actually launched the CT scanners in the trucks in 2018. So we've been going for 1 year. The 3,000th person will be through that truck right about now, and we've got another 4,000 or 5,000 people left to scan.
So in terms of the diagnoses we've made as a result of our lung health checks, we've now found over 40 people with cancer picked up on a screening scan. So the vast majority of these people did not have any symptoms, didn't know anything about it. And for many of these patients, we've been able to offer life-saving treatment.
I think any kind of health check is a really good thing, but especially that particular one, because they can pick up so many. I had no symptoms of either of those two cancers.
To me, it's most probably saved my life, because if it hadn't gone 18 months down the line, there could have been signs there, and then it could have been too late for me.
So I never expected to get the result I did. I didn't have a cough, I didn't have a cold, I'd never had anything. I was quite fit. So it was a shock, but it would have been a bigger shock if I'd have been going now instead of 6 months earlier.
So a huge thank you on many levels to many different groups of people who've made this happen. First and foremost has to be for our donors and supporters who have worked tirelessly to raise the funds to bring this project to life. We've also got to thank our partners, University of Leeds, Leeds Teaching Hospitals, Leeds City Council, all of whom have helped us in different ways. And we know that if you can diagnose lung cancer early enough, your treatment options and the potential of cure is significantly greater.